Hello my dear friends, on watching this video completely, you will learn how anxiety is associated with hypertension or high blood pressure. I will also provide some tried and tested psychological methods to help reduce anxiety and thereby reducing anxiety related hypertension. Please watch this video till the end and like and comment. Also honor me by subscribing this channel. You can consult me through video call if you become a member of this channel. The information provided in this video is purely for psychological purposes and to control stress and anxiety. The information about hypertension or high blood pressure provided in this video is in no way to be taken as an advice from a doctor or medical practitioner. Therefore, you are being cautioned and advised to consult a doctor in person to get more information regarding diagnosis of hypertension, its consequences and treatment. Anxiety and high blood pressure, what is the connection? It is easy to relate anxiety to high blood pressure. After all, when you are anxious, you can get stressed, and stress can cause your blood pressure to temporarily rise. But what about chronic anxiety and long-term high blood pressure or hypertension? Many people think that chronic anxiety and long-term high blood pressure or hypertension are connected. But in reality, it is not a simple cause and effect relationship. Let us dive into the details now. Actually, what is hypertension? Hypertension is a condition in which your blood pressure is consistently high. When your blood pressure is high, your blood can't flow as easily as to essential organs like your heart and kidneys. If that lasts only for a short period of time, like someone surprising you or you are watching a scary movie, this is not necessarily a concern. Our bodies are made to withstand certain amounts of stress, but when your blood pressure is high all the time, like in hypertension, poor blood flow will cause organ damage over the years. Can anxiety cause hypertension? Well, not exactly. While periods of high anxiety or panic attacks can cause temporary high blood pressure, people who have anxiety disorders are just likely to develop hypertension as those who do not. However, that is not to say that temporary increases in blood pressure don't come with risk. In fact, if they happen often enough, they can cause blood vessel damage and put stress on the heart and kidneys. So you end up with the same health problems as those in people with hypertension. Another issue is that people with anxiety disorders tend to do other unhealthy things to ease their symptoms. Things like smoking, drinking alcohol, and overeating are all common ways of coping with anxiety. But those can lead to hypertension in the long run. It is important to monitor your hypertension, but it is also important to trust your doctor and recognize that not all hypertension is caused by anxiety. Anxiety does not always cause hypertension. You are likely to be aware of the former. Hypertension is a natural part of aging and diet. It is something you should monitor and try to control, but it is also something that cannot always be controlled easily. What you may not be aware of is that anxiety itself, a condition that is associated with extreme stress, doesn't always cause hypertension. Even when you are anxious, that is because when a healthy person with normal blood pressure experiences anxiety for an extended period of time, the body actually adjusts your blood pressure levels to account for the anxiety. So, while anxiety can cause hypertension initially, chronic anxiety is considered unlikely to cause hypertension after the body adjusts to it. That doesn't mean that you are in the clear. Anxiety does cause rapid bursts of high blood pressure during attacks and when you haven't experienced anxiety for a while. That high blood pressure can potentially be dangerous, although it is almost always harmless. Similarly, the long-term effects of stress from anxiety could have an effect on blood pressure years into the future, but it is difficult to separate that cause from diet and genetics. Next is white coat hypertension. It is also called white coat effect. The term white coat comes from references to the white coats traditionally worn by doctors. The white coat effect means that your blood pressure is higher when it is taken in a medical setting than it is when taken at home. What causes the white coat effect? Your blood pressure is not fixed. It rises and falls throughout the day in response to what you are doing and what is happening around you. While white coat effect will often happen because you are nervous about having your blood pressure tested by a doctor or nurse. Most of us tend to feel more tense in medical settings than we do in surroundings that are familiar to us. Although we do not always notice it, the white coat effect can influence some people's blood pressure more than others. If you are very anxious, your systolic blood pressure can rise by 30 mmHg. This can make it more difficult for the doctor to get an accurate measurement of your blood pressure. Now, there are some certain ways to reduce stress, anxiety, and keep blood pressure down. When it comes to preventing and treating high blood pressure, one often overlooked strategy is managing stress and anxiety. If you often find yourself tense and on edge, some strategies can help you in long term as well as short term. Number one is understand anxiety well. Anxiety is your body's exaggerated fight or flight syndrome. The fight or flight response is also called hyperarousal. The crumbles or the acute stress response is a psychological reaction that occurs in response to a perceived harmful event, attack, or threat to survival. Whenever you perceive the threat, fight or flight response is activated and stress and anxiety responses takes place. Once you understand this response as potentially harmless, you stop worrying about those symptoms. Once you stop worrying about those symptoms, your auto perception or false perception of threat stops and your fight or flight reaction, stress and anxiety response are reduced or stopped. Point number two, regular physical activity makes your heart stronger. A stronger heart can pump more blood with less effort. If your heart can work less to pump, the force on your arteries decreases, lowering your blood pressure. Exercise also produces a group of hormones called endorphins. Endorphins help your body and mind relax and calm, thereby reducing stress and anxiety. Third point is cognitive restructuring like positive imagery, muscle relaxation, systemic body scan, etc. These CBT methods to manage stress and anxiety, please consult a psychologist for getting training. Fourth point is get enough sleep. Inadequate or poor quality sleep can negatively affect your mood, mental alertness, energy level, and physical health. Point number five, strengthen your social network. Connect with others by taking class, joining an organization, or participating in a support group. Point number six, slow breathing. When you're anxious, breathe as slow as possible, as shallow as possible. Try deliberately slowing your breath. Point number seven, stay in the present moment. Anxiety can make your thoughts live in terrible future that has not happened yet. Try to bring yourself back to where you are. Practicing meditation can help. Point number eight, take small acts of bravery. Avoiding what makes you anxious provides some relief to the short term but can make you more anxious in the long term. Try approaching something that makes you anxious even in a small way. The way through anxiety is by learning that what you fear isn't likely to happen, and if it does, you will be able to cope with it. Next point is challenge your self-talk. How you think affects how you feel. Anxiety can make you overestimate the danger in a situation and underestimate the ability to handle it. Try to think of different interpretations to a situation that is making you anxious rather than jumping to the worst case scenario. Point number 10, plan worry time. It is hard to stop worrying entirely, so that set some time aside to indulge in worries. Even 10 minutes each evening to write them down or go over them in your head can stop your worries. Point number 11, learn from others. Talking with others who can experience anxiety or going through anxiety can help. Point number 12, be kind to yourself. Remember that you are not your anxiety. You are not weak. You are not inferior. You have a mental health condition. It is called anxiety. Next point is nurture yourself. Treat yourself to massage. Truly savor an experience. A massage experience can help you overcome the bodily stress. Point number 14, maintain a healthy lifestyle. Maintaining a healthy weight, not smoking, regular exercises, and diet that includes fruits, vegetables, whole grains, lean protein, and healthful fats. The blood pressure will be under control. Point number 15, being intimate with your partner, having sex has been linked to many health benefits in research, including lowering blood pressure. Next point is sniffing on lavender perfume can help reduce anxiety immediately. Please ask for help. If you have these problems, you can ask help from your friends, neighbors, family, all. still it is overwhelming, you can always consult a doctor. Thank you for watching this video. Please become a member in this channel. Thank you.